So hopefully this event offers a valuable opportunity to reflect on both the historical and contemporary experiences of LGBTQI plus communities, to examine the health inequalities that they continue to face across healthcare systems. So this evening's session focuses specifically on the relevance of these inequalities to physiotherapy practice. LGBTQIA plus people experience disproportionate barriers to accessing safe, inclusive and effective healthcare, which contribute to poorer physical and mental health outcomes. So as a profession grounded in evidence-based, person-centred care, physio has a vital role in recognising, addressing and challenging these disparities. So I had the privilege of attending this session at the Physio Conference, Physio UK 2025 in Newport, where its combination of evidence, contextual background and lived experience provided a really powerful foundation for learning and reflection. And it wasn't just from Paul and his brilliant panel. Fellow CSP members in the audience also felt safe to share their stories and experiences too. And being there in the room, it just was a really very powerful and emotional session that stuck with me from I was there for 3 days, and this session particularly really stuck with me. So we hope that this webinar will increase your awareness of LGBTQIA plus health inequalities, explore their implications for clinical practice, education, research and leadership, and support physiotherapists in delivering that care that's inclusive, respectful and responsive to the diverse needs. So in doing so, it should reaffirm our collective professional responsibility to promote equity, challenge discrimination and contribute to improved health outcomes for all. So I know you're going to enjoy the session, so please sit back, listen, absorb, and hopefully this can influence your practice going forward. Thank you.
Hi, good evening everybody and welcome to our webinar. My name is Paul Rees, my pronouns are he, him, and I am the chair of the LGBT network for the Chartered Society of Physiotherapy. So we're going to do some introductions first of all. So I'd like to, Mike is next on my screen, so I'll ask Mike just to introduce himself.
Hi everyone. I'm Mike Pearson. I am the vice chair of the CSP LGBTQIA plus network, and my pronouns are he, him.
Emma?
Hi, sorry. I'm Emma Powson. My pronouns are she, her, and I'm also on the committee.
And last but by no means least, Shan?
Hello, I'm Shan Pinnington. My pronouns are they, he. I'm in the leadership committee as well for the LGBTQIA plus network, and I'm also a specialist neuro rehab physio in the Northern Care Alliance.
So thank you so much. Let me just share my slides.
Just while Paul's getting all that set up, just to let you know, this is all set up as a webinar, so hence we can't see you and we can't hear you, but you can put comments into the chat or also into the question and answers, and we'll go through those, try and answer any questions that people have as we go along.
If I do that, can you see everybody now on my slides?
Yeah.
Right, let's get rid of that there. Okay, so thanks ever so much for joining us this evening. The motivation for this webinar, well, our session that we did at conference, was really to kind of start to extend the conversations around health inequalities more broadly. Over the last couple of years, we've seen an increase in the number of health inequality sessions being embedded in our conference agenda. These health inequality kind of conversations are very welcome. And I guess that from our perspective as a network, well, we welcome the opportunity to kind of explore and increase our understanding with people with maybe from different cultures or ethnicities. Really, there was an absence of LGBT inclusion in some of those health inequality conversations. So what we wanted to do was to be able to provide an opportunity and provide a platform for the CSP's LGBT network to be able to tell our story and highlight the importance of considering these health inequalities through an LGBTQI lens. Before I go on, I just want to draw your attention to, we've added a number of QR codes throughout the presentation, which will take you on links to a number of the resources that we've included. All right, so the aims for today's session. Let me just leave that on. So we want to build an understanding of the unique challenges faced by LGBTQIA individuals, to examine the role of physiotherapists in addressing healthcare inequalities, and to identify strategies for LGBTQI inclusion in physiotherapy practice. The structure for the session this evening, going to have a brief introduction around health inequalities from an LGBT perspective. And then we've got some amazing lived experience speakers. They're going to share their experiences. And then we're going to follow up at the end with a panel discussion where you're able to submit your questions below in the chat. And then we can start to try and work through them. What we wanted to do this evening was to be able to create a safe space. And it's important to be in being able to do that, to consider a number of aspects. So we want to be respectful with communication, speak respectfully to one another, actively listen, and be mindful of language. Confidentiality, what's shared in the room stays in the room. The right to be human, respect each other's humanity, including the right to have a bad day or make mistakes. We never fully know what's going on, and it's important to keep this in mind as we connect and collaborate together, showing kindness and understanding. This is a learning space where everybody should be able to express themselves without fear or judgment. We encourage questions, curiosity, and open dialogue. Respect differences. Recognise that everybody brings unique experiences and perspectives, and make different diverse voices respected and the lived experiences of others heard. Assume positive intent. We're all here to learn and grow. We understand that mistakes happen, and we're all here to learn together. Own your own impact and challenge ideas and not people. So, what we wanted to do as an introduction to starting to talk about LGBT health inequalities was start by trying to help people to navigate the acronym. So some of these you may be familiar with, some of them you may not necessarily be as familiar with. So lesbian and gay, they're maybe phrases that you've heard more consistently. So lesbian is a woman who's enjoying physical and romantic or emotional attracted and is emotionally attracted to other women. Gay is an umbrella term used to describe individuals whose enduring attractions are to the same sex. Bisexual is a person who is physically, romantically, and emotionally attracted to people of their own gender and other genders. Transgender is an umbrella term for those who identify, whose gender identity differs from the sex that they were assigned at birth. Q has a double meaning. It is referred to as queer or questioning. So queer used to be considered a slur, a homophobic slur, and a number of people from the LGBT community still consider it to be a homophobic slur. However, within a young generation of LGBT, within the LGBT community, queer is more accepting of an umbrella term to be able to describe people that are gender or sexual orientation diverse. Questioning would refer to sexual gender identity that does not correspond to established ideas of sexual gender identity. Intersex is individuals born with a variation in the sex chromosomes and sex characteristics. And asexual or aromantic is a lack of sexual attraction or a lack of romantic attraction. So how many of those did you know about? How many of those are you learning for the first time? So as a network, the CSP's LGBT network has existed for a number of years, And I guess that these really are our kind of mission statements. We want to amplify voices, hence the opportunity to provide the webinar this evening, highlighting and showcasing diversity of voices from our network. We want to grow the network, so we want to use this as an opportunity to be able to spread our message, spread the messages of inclusion, and to try and grow our membership. And creating a supportive community for all LGBT members by promoting allyship across the CSP. So, let's start to talk a little bit more about health inequalities. So, the European Journal of Public Health study suggests that LGBT people face unique exposures to stress, which is compounded by prejudice, discrimination, sexual orientation and concealment, expectations of rejection, and internalized stigma. This report was carried out by Stonewall, identifying that half LGBT people said that they experienced depression in the last year. 1 in 8 LGBT people said that they've attempted to take their own lives in the last year. But almost half trans people have thought about taking their own life in the last year. 31% of LGBT people who aren't trans said the same. And then another statistic for you: 37% estimated those who identify as being LGBTQ+ are also neurodivergent. So what we're starting to introduce is the concept that the LGBT community have some unique health challenges and some specific characteristics based on their lived experiences. Again, this is another resource which we want to share with you, talking about people's experience of discrimination or negative remarks. So almost 1 in 4 people from an LGBT background have witnessed discrimination or negative remarks against LGBT people by healthcare staff. 1 in 5 who aren't LGBT people aren't out to a healthcare professional. And 1 in 7 avoided treatment for fear of discrimination. This was a study that was done, I think, in 2019 and published by Megan Ross, who we are looking forward to welcoming to the CSP for a research event that the network are hosting on Thursday. The research looked at people's perceptions and assumptions and their perceptions around discrimination for LGBT individuals that have attended physiotherapy. So this was a qualitative design using a survey, and 108 people met the research criteria. From the research, there were 3 assumptions that were, there were 3 themes that were identified. The theme 1 was assumptions about sexuality and gender identity. Theme 2 represented the discomfort and the association with physiotherapy and like close proximity and exposure of their bodies. Theme 4 represented thoughts around discrimination. So reports of discrimination by physiotherapists that were both explicit or implicit. And in the absence of explicit or implicit discrimination, there was an ongoing fear of discrimination, whether or not that discrimination had happened or not. So as physiotherapists, how do some of the things that we've just considered impact on what we may see in our physiotherapy clinics? Code switching. So that's a term used to be able to kind of switch between maybe an LGBT and a kind of a heteronormative narrative. Ambivalence in accessing healthcare. People understanding that accessing healthcare promptly is really, really important, but the ambivalence is about their past experiences impacting their willingness to be able to engage. Cautious communication. We understand that if people have experienced discrimination, they're less likely to be fully engaged and be able to fully articulate their symptoms, which could be important for conditions like Cauda-Equina syndrome, for example. Lower levels of self-efficacy. An avoidance or delay with healthcare screening, particularly when we talk specifically around cervical screening and things like that. So we wanted to introduce something about active lives. So for those who weren't able to join us in Wales in November, one of the conference themes was active lives. So we wanted to use an opportunity to be able to investigate and to be able to articulate some of the challenges that may happen within the LGBT community when we start to talk about sport, activity, and exercise. So this was a study that was done in collaboration between a group called Pride Sports and Sport England. Found that 55% of men were not active enough to maintain good health. 56% of LGBT women were not active enough to maintain good health. And 64% of LGBT people who identified as something other than male or female, i.e. gender fluid or genderqueer, were not active enough to maintain good health. Again, another report that was done around active lives from 2023 and 2024. While lesbian and bisexual women aged 16 to 54 are likely to feel that they have the same ability to be active, this was not consistent. Gay men are less likely to enjoy being active compared to men as a general population. Gay men are less likely to feel that they have the opportunity to be active compared to the average across all men. And gay and bisexual men are less likely to feel that they've got the ability to be active than the average for all men in the same age bracket. So this, again, is another report that was done in collaboration between Sport England and Pride Sports, and focused on the perceptions on the perceptions of people that were non-binary. There was a report that within the report they identified that people that were non-binary were less likely to enjoy PE, less likely to feel comfortable taking part in PE and sport in school, significantly less likely to enjoy taking part in sport at school or at lunchtime, less likely to feel that their ideas were listened to, and less likely to feel confident in trying new activities compared to male and female counterparts. So what we have got for you now is some of my LGBT network colleagues starting to talk about their own lived experiences of being from the LGBT community, but also the experiences of being active and engaging in sport and exercise. So I'm going to stop sharing and hand over to our first lived experience speaker, who is Shan Pinnington. Thank you so much.
Hello. Can you hear me?
Loud and clear.
Nice. Okay. I realised it's a bit different to last time because we did it in person at conference last time. So if anyone has any questions or feedback or anything, If you want to chuck it in the chat at any time, I'm just going to keep my eyes off it so I don't get distracted, but we can go back to it during the panel discussion at the end. So my name's Shannon. I'm a pronouns a they, he. For me, that means that I prefer they, them, theirs pronouns, but I'm happy if you want to throw a few he's, hims, and hises in there. I'm a transmasculine non-binary person. So to simplify what that means for me, I was assigned female at birth, but I don't feel like a woman or a man. However, I do resonate more strongly with masculinity. These terms refer to my gender, but I'm also pansexual or bisexual. I'd feel dishonest if I didn't mention some other characteristics of myself that have an impact on my health. So I'm also autistic and I've got ADHD. I also have some invisible disabilities. The one which impacts me the most is my hypermobile Ehlers-Danlos syndrome, or HEDS. And some of you might be aware of the gender diverse ADHD head Venn diagram, which I've got the whole trifecta of. However, today I'm focusing as much as possible on the LGBTQIA plus stuff. So I'll primarily be discussing two key themes regarding my own lived experience of health inequalities as a queer person. So the first theme is around barriers to engagement in team sports growing up. And to speak on this, I should make you aware that until I was 27, I presented as a girl and then a woman. I'm now 32 and I've been out as transmasculine for 5 years. So in primary school, sports were really heavily gendered. Boys played rugby and football and girls played netball and hockey. But I loved the boys' sports and I loved all sports actually. Anything that meant that I could run around and be on an equal playing field to my peers, pardon the pun. This meant that at break times, I was the only girl playing football on the field. I'm going to stop this now already. I'm already bored of myself. Whenever I say girl, imagine I'm doing this. So I was definitely the only girl trying hard in PE because it was cool to not try hard and to sit on the sidelines looking pretty, but nobody had told me this. So over time, I was socially excluded by the other girls in my class. Generally, the boys were fine with me playing with them and treated me like one of them, except for the occasional instance where I scored a goal against one of the more toxically masculine kids who were furious that I, a girl, could have beaten them. And I did actually need the protection of some of my more mature peers from being beaten up for daring to be good. In a more psychologically harmful way, I remember being told by some of the other boys that I was manly or a lesbian, meant as an insult when I did well in games. Oh, sorry, just nearly knocked you over. For a short while, Shannon the Manon was my nickname, because little boys are just so creative. And on reflection, I saw these traits as being unsafe and undesirable. And I think this contributed to my turning hyper-femme in high school, but we'll talk a bit more about that later. When there were more competitive girls' sports events in primary school, I happily put my all into it. But as a girl playing against other girls, I was told I was too rough. Translation, I was being competitive in a competitive arena during contact sports. Now, I strongly feel that had I been recognised as not a girl, I would have been praised for my competitive energy, and in a boys' team, it would probably have been nurtured. This has really stuck with me. I didn't fully realise it until I came to write this, but I've avoided team sports since then. I'm sure, like many people who are conditioned as a girl growing up, I've always been overly aware of the space that I take up, and this translated into being overly careful during sports. There's no doubt in my mind that this hugely affected my performance, my enjoyment, and eventually my engagement, subsequently affecting my overall fitness growing up. When I went to high school, it felt like a fresh start. Only one person at my primary school had gone with me to the BOF school, which was our generation's crap word for nerds, so I'm showing my age there. And I had a chance to not be bullied and ostracized for being different. I'd already started going through puberty, and so I got what I was told was positive attention from the boys in my year. And so I was quiet and I didn't take up space and I did exactly what was expected of me. I wore makeup and short skirts and was popular and had generally a pretty fine time. But when it came to exercise, I played on the girls' netball team and did okay because I wasn't overly competitive, but I was tall. At break times, I sat with the other girls and chatted while we watched the boys play basketball. When there were talent shows, I danced with the other girls, even though it absolutely wasn't what I wanted to do, but it was expected of me. After a few years, I wasn't good enough anymore to be in the first team for my school netball team, and so exercise dwindled out of my life until it was effectively non-existent. At university, I dabbled in team sports. I tried out for the netball team, and being consistent to my conditioning, I avoided being overly competitive, which led to me getting into the sevens team. So I smashed it, obviously. I played the occasional game of mixed five-a-side football with my friends, but all I could ever think was that I could not be rough or aggressive, and I should definitely never attempt to tackle under any circumstances, just in case I hurt someone and was berated for being too competitive or masculine or, heaven forbid, a lesbian. And it should be noted that this time in my life, I had finally come out as not straight and was actively making out with women on nights out. But my frightened brain didn't seem to see the irony in this. Of course, at this point, I'm fairly sure that my male peers had a bit more confidence in their masculinity and would have congratulated me for an attempt at a tackle. But sadly, it would take more than that to counteract 18 years of social conditioning. All this to say, I truly believe that had I not become a physio and properly understood the importance of exercise, I likely would have stayed relatively inactive for the rest of my life. And I still avoid team sports. But now that I've made this revelation, who knows? So watch out, world. My second theme will be much, much briefer, so no need to worry. And it focuses on my experiences of healthcare in adulthood related to my being an openly queer trans person. To complement my autistic brain, I'm just going to list a few of the NAF experiences I've had. So I attended a Pride in Practice GPs, but then was repeatedly referred to as she, her, or hers, despite frequent corrections. Repeatedly being told that most other women having this procedure experienced this or that, even though I reminded them that I'm not a woman. Having to chase up my referral to a gender clinic twice because after a year of waiting, I found out that I'd never actually been referred. Being asked by my clinician if I have a vagina or a penis. Just wait, I know it sounds bad, but this was actually appropriate since I was having a sexual health checkup. But then I was asked if I had plans to have bottom surgery, which was totally irrelevant. And then he asked me what my fiance's sexuality is to be with someone like me. Being told that although I'm strongly considering masculinizing HRT, my only option to help with debilitatingly long and heavy periods as a result of PCOS is to go on progesterone. Having to be diagnosed as having a disorder called gender dysphoria in order to be legally allowed to have top surgery, even though I'm one of the lucky few who's been able to go privately for this. And my transness is not a disorder, thank you very much. Being told by the psychologist diagnosing me with the said gender dysphoria that she can't possibly write that my pronouns are they, he, because that's just way too confusing. And so I've got to pick either they or he, just the one. A consistent lack of support around my gender affirming top surgery because post-op surgery physiotherapy just isn't a thing, whether you go private or through the NHS. Recent physiotherapy for scapular pain, where I feel like I was likely not accurately assessed because I was wearing a t-shirt and there was no discussion about potential undressing for assessment. But if she had asked me if I was comfortable with taking my top off, I would have said yes, but it felt purposely avoided. And so there feels an obvious split between clinicians who just aren't comfortable asking relevant but trans-related questions and those that aren't afraid to let their curiosity run away with them, from them, no matter how inappropriate it is. Now, this is clearly not cool. And were I less stubborn or maybe less disabled, it may have had a huge impact on me even attempting to access healthcare. So what about every other trans person who needs our help but avoids making an appointment for fear of similarly awful experiences? It's really just not acceptable. So to conclude my massive rant, I'm making a request that if you take anything from what I've said today, it's encouragement to go and educate yourself on queer lived experiences. There are thousands of people on social media who are telling us exactly what they need. Please let's listen. Thank you.
Thank you so much, Shan. I really appreciate that. Such honesty. I remember the first time that you shared that with me. I was like just very, very humbled about some of your experiences. So thank you so much for sharing. Mike, I'd like you if you could come to you next.
Thank you. So I guess my reflections around lived experience are starting really as around sports element, around that physical activity and how I was made to feel when I was younger. And I think whilst I didn't necessarily know that I was gay, I didn't necessarily know that, exactly what was happening. But what I did know is I was different. I did know that, and my peers could see I was different. And there was that real fear, that real discomfort around school sports, and wider, sports as well. That walking into a changing room and just that energy, that atmosphere, everything that was there, and just feeling like I didn't belong, feeling like I wasn't part of that world. And I think for me, that was really striking. I think probably, whether it was because I was growing up and I was maybe just not comfortable in my body, etc. But there was certainly elements of feeling very clumsy, feeling very almost a bit dyspraxic, and that fed into all of those stereotypes you get of being the last person picked on a team, or trying to kick a ball and it going completely in the wrong direction and everyone laughing at you, and all of those kind of experiences that you get, which just really take you out of that environment and just to feel completely alien. I did on one weekend, I recall that a friend of mine was going to like a Saturday cricket club at a local school. They were using the school field for it, and he invited me along. I didn't know anything about cricket really, other than you had a bat and you hit a ball. And they were like, "Oh yeah, come up, come up to bat." And it's like, and you've got this umpire or person refereeing saying, "Have you got a box on?" I was like, well, I don't know what one of those is. What's going on? And then I was like, worked it out, put it in. Did that, but it was just so humiliating in front of everybody. And it's all those kind of experiences that you have that really just eat away, and you go, I don't want to be involved in team sports. I don't feel I'm good enough. I don't feel that I'm able to be part of that. And it just chips away. And I think I have generally been that person who has kept away from sports, particularly team sports. And I could quite easily have be in that situation where you just said you wanted me to do some exercise, and I would be like, no, not at all. I think really it wasn't until I ended up going and doing a physiology course, which then I converted to physiotherapy, and I understanding that whole importance of movement and things like that, and I'm definitely much more comfortable doing individual exercise, but then it's motivation, and it's all of those kind of balance of things. And I know it's not necessarily unique to people who are LGBTQIA, but in terms of my personal experience, that's definitely had an impact on how I felt. And then it's a whole thing of, well, you're in such a masculine environment, and if you were to go into it when you did realize you're gay, actually, would you be prepared to step up and go, hi, this is me? I grew up, my formative years were in the 90s, which obviously we were a different time. We had Section 28 was still there, and all of these things, and things have moved on. People are discussing things in the day-to-day through social media, and there's that better understanding, and you can find your people to have those conversations and share those experiences. But it can feel very lonely when you're not in those moments feeling like you're being seen by anyone at all. So yeah, so I think a bit like Shan said, that I'd feel very different if I hadn't become a physio and started to understand the importance of physical activity. And I think it's about remembering we all come to things differently, and just because one person is a very sporty or athletic person, or we're referring people and saying, well, you need to go and do these exercises or these exercises, that actually there are potentially going to be some barriers there and things that people need to be taking into consideration when we prescribe sports or exercise or anything like that, and how we then convince people to maintain that as well. You know, a lot of potentially trying to help people build up their confidence again as well. So I think that's all I've got to say.
Thanks so much, Mike. I think it's really important to kind of emphasize that one of the things that we wanted to try and articulate was that as physios, we know the value of exercise for musculoskeletal problems, for a variety of other conditions, for heart disease, respiratory problems. But I think that what we wanted to try and be able to focus on is that if we're introducing exercise into our treatment regimes, then we've got to just be able, we just want to highlight and try and support people to be aware of some of the issues that people could have experienced that could detrimentally impact their willingness to engage in exercise. So, going to move on to our final lived experience speaker, Emma. Just what I'm going to make a request is that if you do have any questions, if you could put those into the chat, and then we'll keep an eye on the chat and we'll start to maybe work through those in a little while. All right. So for the time being, I'd like to hand over to Emma. Thank you.
Hi everyone, can you hear me? Okay.
Yes.
Yes. Apologies if there's noise in the background. I am on holiday. So hopefully it'll be okay. Right. I think it's gone slow. Oh,
You're all right. Keep going.
no, my speech has disappeared. Sorry. 2 seconds.
We can hear. Okay.
I'm just finding it again.
You're
Well,
right, Emma, don't worry.
I feel this is a little bit like the Eurovision Song Contest. Can you hear it as Portugal?
Why? Yeah, I'm in Portugal, everyone. Yeah. My pronouns are she, her, as I mentioned. I'm now band 6 rotational physio working in Swansea. I want to start by thanking you for giving me the space to share something that's both professional but also very personal. Today I'm not speaking only as a physiotherapist, but as a queer woman whose early experiences in sport shaped how I understand the barriers many in our community still face. So growing up, I was always drawn to sport, especially team sports. I love being active, I love the sense of belonging, and I threw myself into everything I could. At that age, I was not thinking about gender or stereotypes. I was just a girl who loved playing sports. It was only when I got older that I realised how differently people saw me depending on the sport I was playing. The rugby pitch, the football field, the netball court, each came with its own assumptions and judgments. I did not understand it at the time, but those moments were shaping how I saw myself and how I would later understand inequality. One of the clearest memories I have from year 9, my final year of mixed rugby. We were heading to a tournament, and I remember nervously asking if there'd be other girls. I was told there would be, but when we arrived, I found myself standing among 200 boys and not a single girl. I was not scared of the sport. I was scared of the staring, the comments, the feeling of sticking out. Some boys didn't want to play against me because I was a girl or because they thought I was weak. Others made comments that were inappropriate and sexualized, the kind of thing no 13-year-old girl should have to hear while trying to play a sport she loves. I remember feeling completely out of place, as if my gender mattered more than my ability. It was the first time I realised that sport was not just about skill or passion. It is also about perception, and perception's not always fair. That same year on sports day, the girls were told we were playing rounders. No discussion, no choice. Meanwhile, the boys got football. It sounds small, but moments like that chip away at you. They tell you why you're allowed to exist, and they tell you how much space you are permitted to take up. I wanted to play football, so being a confident child, I wrote a letter to my head teacher explaining why I should be allowed to play instead of rounders, and why it was unfair that we weren't given a choice. It still didn't work. I had to play rounders, and coincidentally, I stopped playing football not long after that. Looking back, it felt strange that I had to write a letter just to be allowed to join a sport, and even stranger that it didn't change anything. But that's the reality of gender assumptions in school sport. Sorry. The stereotypes did not stop there. Even at home, my parents would make small jokes about how rugby probably meant I would turn out gay. They were not trying to be hurtful, it was simply the stereotype that surrounded women's rugby for years. As I moved through my teens, those stereotypes became more subtle, but more constant. Rugby seemed to confirm that I might be gay, football was treated the same way. Netball suddenly had people questioning whether I might actually be straight. It felt like people were trying to work out my sexuality based on the sport I stepped into on the day. It was something talked about casually, joked about, assumed long before I was ready to talk about it myself. Even when these comments were brushed off as banter, they did not feel harmless. Made me doubt myself, made me feel watched, made me hide parts of who I was, and that I did not feed into the cliches people already decided were true. Sport gave me confidence, community, and strength, but it also taught me far too early that being different comes with scrutiny. Everything shifted when I went to university and joined the women's rugby team. For the first time, I was not the odd one out. I was not the only girl who loved full contact sport. I was not the only queer person in the room. I was surrounded by strong, confident women who were openly themselves, and it was such a relief not to feel judged or whispered about. It was not that rugby made people gay, it's that women's rugby provides a space where queer women finally felt safe enough to be themselves. Being in that environment changed everything. It helped me relax, it helped me stop hiding. It made me realise what I'd been missing was not confidence, but it was community. At the same time, I became very aware of the contrast in men's rugby. Across all the grassroots teams I know, there was not a single openly gay player. The silence did not feel accidental, it felt cultural, like some parts of the sport were simply not ready to make space for them. That stayed with me. When I eventually found my way into physiotherapy, I did not immediately see how my background in sports shaped the clinician I was becoming. But the more I worked, the more I noticed familiar patterns in some of my LGBTQIA plus patients. The hesitation before sharing something personal, the careful phrasing, the pauses, the quiet worry about being judged or misunderstood. I recognized these things because I felt them myself. Many people in community approach healthcare with caution. Some worry assumptions will be made about their sexuality, some feel their partner will not be acknowledged, others worry their gender identity will not be respected, and some are simply afraid of not being believed. These fears have consequences. They lead to delayed injury reporting, inconsistent engagement with rehab, and higher dropout rates for physical activity. For a community that already faces disproportionate health inequalities, those barriers are significant. In physiotherapy, we talk a lot about biomechanics and outcomes, but our work is also about people, stories, and trust. We have to spend more time with patients than anyone else in their healthcare journey, and that gives us a genuine opportunity and a responsibility to create a space where people feel able to show up with their full selves without fear. So as we talk today about health inequalities, I want to remind us that inequality for LGBTQI plus people does not begin in adulthood or clinics. It starts much earlier in the playgrounds, changing rooms, football pitches, netball courts, rugby fields. And that means our role is not just treating injuries, but challenging the systems and assumptions that taught me to be strong. Physio taught me to help others find their strength. And being part of the LGBTQI plus community taught me that strength is not just physical, being seen, feeling heard, and being safe. My hope is that we continue building a profession where every patient, every practitioner can feel that strength without fear of stereotype or exclusion. Thank you.
Thank you so much, Emma. Again, some really powerful words. And again, I think there's a theme there that I wanted to try and pull out about like the experiences of LGBT individuals in the formative years at school. And I guess that some of those experiences then shape behaviors and culture through into adult life. So if like people don't feel included, particularly from a sport and exercise perspective, the impact on adult life and adult life chances then become highly significant, highly impacted by some of those experiences early on in life. Just going to go back to the presentation, just show you another couple of slides just before we then finish and just answer some questions. So just bear with me 1 second. I'm going to just change the slides. Okay. You should be able to see that. So, spoiler alert. Right. So, where we wanted to kind of come back to was to say, to start to kind of pull things together a little bit. And I guess that we're better placed to start than the HCPC guidance that I'm sure that everybody is completely familiar with, especially at a time that we are all renewing and revalidating. But there is something specific that I wanted to refer to, and that is the Standard 5. So the revision of the HCPC guidance happened in, I think it was September 2023. And there'd been a long consultation between healthcare bodies, professional bodies, and the public itself. For me, when we're talking about inclusion and when we're talking about belonging, Standard 5 has a really important role to play in how registrants are expected to deliver on those things. Previously, HCP guidance has promoted an awareness of inclusion, but the guidance from 2023 onwards mandates registrants to have a greater level of activism in terms of how they engage with inequality and how they overcome barriers to reducing discrimination. So there are a couple of things that I wanted just to kind of draw your attention to. 5.1, respond appropriately to the needs of all different groups and individuals. Understand equality legislation and apply it to their practice. Actively challenge barriers. So at this point, it's no longer acceptable to acknowledge that barriers exist, but actually challenging registrants to actively challenge the barriers wherever they occur. From the CSP's perspective, this was a seminal document that was published last year. Working with transgender people in physiotherapy practice, a guide for members. So this was done in collaboration with a number of members of the network and was co-produced. It has 3 levels of kind of activism and kind of health promotion. At clinician level, at service manager level, and those that are involved in designing clinical pathways. So clinicians, it advocates the use improving people's knowledge and understanding of working with individuals who identify as transgender, promoting correct pronoun use, encouraging reflection around a consultation, how to maintain dignity, how to deliver high quality care that is compassionate and understanding, conversation about removal of clothing, and how to promote allyship. At a service manager level, how do we maintain record keeping? How do we ensure that our EPR platforms have the functionality to be able to change names or change pronouns depending on people's journey through their transitioning? And from a service design, identify spaces that are acceptable for everybody, promote inclusive documentation, and engage in co-production. The government white paper for the next 10 years advocates co-production in the development of NHS services. So this is a really good opportunity to be able to include minority groups in being able to shape services of the future. This was a paper that was published just before conference last year. And although it specifically refers to gender-affirming physiotherapy services, the responses for me are widespread and give us an opportunity to be able to consider about how we could consider some of these themes and embedding these themes in more mainstream physiotherapy practice. Ensuring that treatment and care is holistic and person-centered. Ensuring that it's safe and inclusive. Using clear language and communication. Having a knowledge of gender-affirming physiotherapy. considers potential body discomfort, inclusive, safe and accessible. So for me, those elements provide us with an opportunity to be able to start to shape how we build inclusive, LGBT inclusive physiotherapy care moving forwards. So, questions. Okay, let's get rid of the slides and look to see any questions at all. So I've got a few questions. All right. So I guess that in terms of like, what are your suggestions of like things that people on the call could potentially consider in kind of embedding in their practice? Let's start with Mike.
Embedding in practice. So
Yeah.
I think for me, I mean, as a physio working on the wards, some of my reflections and experiences have been around, should I disclose that I'm gay to my patients? Should I not? Have they should I give them the opportunity to have that conversation, or should I just, I think there's sometimes a lot of internalized homophobia where you go, well, actually, I don't want to put this person out, therefore I'm not going to be myself. I remember as a younger physio, lots of the older ladies on the healthcare, the older people wards would be like, oh, have you got a girlfriend? Are you courting? All those kind of things. And rather than go, no, I'm gay, I've got a partner, I would be saying, oh, no, not at the moment. Or, I'd kind of dismiss that. And I do reflect back and feel that by not having those conversations, I was potentially denying myself, but also denying the opportunity for, growth and people to learn as well. You're just hiding yourself away. But I think that was part of that protective side of things. Later on in my career, and we've had the NHS badge for the rainbow badge. And I was wearing one of those along with a rainbow lanyard, which I trusted got at the time as well. And I went to see a patient. This was just after COVID. And we had a patient on the ward I was on. He was a gentleman, probably in his 70s, maybe a bit older. And he and his partner, who's male, had both been admitted with COVID to the ward. And sadly, his partner had passed away the week before. They had, as a trust, put them both on the same ward, so they were together. So that was, some comfort. But in that moment of him seeing that badge, seeing that lanyard, he said to me, "Are you a friend of Dorothy as well?" To which I was like, "Yes, I am." And we had a lovely conversation. And he was able then to reflect, and I think that openness, that he could see a connection. He asked the question, and that provided a really emotional moment for both of us. But I think from him, just him being able to be himself and say things, because obviously, as an even older gentleman, having lived through when being gay was illegal, all of those experiences they've had, and there's that lived defensiveness. You don't go out there and you don't make a big thing of it or anything like that. So yeah, I think for me that was important. From a health inequalities point of view, I think for me it's about if we understand where people are coming from, and this is across everything. This is not just LGBTQIA specific. If we take the time to stop and listen to people and understand where they're from, we can give them the best support and advice and help them to overcome some of these barriers. And I think for me, that's one of the important things to kind of take from this session, is around, by slight subtle changes, we can have a real big impact on people.
Thank you, Mike. There's a question from Sally. Thank you so much, Sally. Sally says, I'm sure that we're all aware about the recent cases involving changing facilities. How do we provide a good service to LGBTQI patients when we struggle to provide this for LGBTQI staff in the NHS? What does the panel think? So any volunteers? I've got a few thoughts about that. I guess that I think that from my perspective, I think that one of the reasons that we're trying to kind of talk about LGBT inclusion, more generally, and we ran another session last week about allyship. I guess that whether or not we're working with colleagues or whether or not we're working with patients, actually trying to develop skills and an understanding around allyship, for me, is really, really important. Geopolitically, we're in a really difficult time at the moment, and that time includes high levels of uncertainty. And so I guess that being able to be kind, be able to be curious, to be able to demonstrate belonging. I think that Alex and I, when we spoke last week, we talked about equity and being able to kind of understand that about how we can kind of demonstrate equity either to our patients or to our LGBT colleagues or any colleagues from a minority background. So I guess that those are some of the things that immediately spring to mind. I know that from an NHS estates perspective, so many of the NHS estates are outdated. So actually we should be the estates of the future should be inclusive, including inclusive changing rooms, inclusive toileting facilities, because that's where the headlines tend to take us. Shan.
Hello. That is a really hard question. I don't have a solid answer, basically. I'm just reading your question. Sorry, 1 second.
So it was a question: how do we provide a good service to LGBTQI patients when we struggle to provide this for staff?
Yeah, so I am actively trying to advocate for LGBTQIA plus staff, obviously here within the CSP, but also within my trust as well, in the network, and as a LGBTQIA plus champion and all these things. But I think in terms of trying to do things for my patients when they aren't already readily available for staff, it is really hard. So I think the thing I would say is just try to do things that identify that you're a safe space. So whether you're trans or not, wear a pronoun badge, because then it identifies that people can share their pronouns with you. I would prefer if all physios would introduce themselves with their pronouns, because it would just show, again, that you're a safe space and that you kind of have a basic understanding of transness and things, and just not making assumptions. Don't ask people about their husbands and wives, ask about partners. And if someone does say that they have a husband, don't assume if that person's a woman that means that they're straight. And just trying to be aware of barriers that might get in people's ways. If someone is looking uncomfortable about something, just try to kindly find out what you can to make things better for them. But it is really hard. Yeah, there's no easy way about it, unfortunately.
Thank you so much, Shan. I'm just going to come to James's question, and then we've got another question, and then I'm mindful of time. Alex, you've got your hand up actually first. Let's come to you.
Oh, sorry, it was about James's question, so I don't know if you
Oh,
want
was
to go
it?
first or
Okay.
if you want me to just chip in. Just also,
Yeah, do you want to start? I've got some ideas
yeah,
about that as well.
yeah. So I realised I didn't introduce myself at the beginning either. So I'm Alex Rees, I'm Vice-chair of CSP Council. And as Paul said, we did do a session last week on allyship. And I think, James, you're right. It's around how this and the conversation, again, we've been talking about these lived experiences started in school, early life experiences. And it made me think about how we direct this to paediatric colleagues as well, which obviously there's even more challenges in discussing these issues in paediatric settings. I know from a couple of my colleagues, but to go back to the question around HEIs doing anything, or we as the CSP trying to influence, it's really difficult because what we find at ARC every year, there's lots of things that actually you think they should be on the syllabus at the degree level programme. Not just about, from a diversity network point of view, but just from special interests and paediatrics and et cetera, et cetera. And we've got quite a lot of CSP members who are lecturers and teach on these courses, and what they said is if we put everything on that we would actually want on, you turn it into a 4 or 5 year course, not a 3-year course, and the curriculums are already really stretched. So I think we haven't got much leverage at the moment to have anything like this that we'd want to have on added to curriculums, but it doesn't mean we can't influence. But I was just bringing up again that these things can be debated at ARC, and then that's how we can get more of a steer from a CSP perspective. But I think it goes back to what you then said in your own question, James, about a lot of the things you've learned from your own family and friends, etc. And that's what we were talking about from an allyship point of view last week. That actually you've done the thing that you do. You've gone out and you've tried to self-educate yourself. You haven't had it spoon-fed to you somewhere. But also to flip it on that, well, your family and friends will be patient at some point along the line. So it's around, well, how you can take that knowledge from a family and friends and still turn it into that professional behaviour and professional empathy and, professional how you're dealing with patients, because it looks like, well, you're on this webinar as well, so you are there trying to actively learn. So that's great. So I think it is disappointing that we can't get anything directly onto the curriculum at the moment, but it doesn't mean we never will. There's ways and means of trying to influence that, which we will do if that's what our members want us to do. But yeah, it was a great question.
A couple of things I wanted to say. So thank you, Alex. There are a couple of things I just wanted to kind of mention as well before I bring Shannon. So I didn't come out until I was in my kind of like mid to late 20s. So I was a late bloomer, you might say. And I guess that my journey, like my queer journey, has kind of evolved, and part of that learning process is being able to listen to kind of powerful people that talk powerfully. So I said earlier that like Shan, when I first heard their like presentation for conference, I was really, really humbled. For me, I always am drawn to like qualitative, like lived experiences, which is one of the reasons why I kind of wanted to put this together in the absence of wider kind of literature. But I guess that my journey has involved lots of people, listening to lots of people, because I came from a white middle class background. My parents are both together. The area that I grew up there was no diversity. So for me, it's been a curiosity to learn. There's been curiosities to try to understand people's perspectives. And I guess that for me, that's an individual journey. Of course, I would like people to like more readily engage with like LGBT issues, but I guess that like my own journey is something which is again is quite personal, that I've kind of had to navigate through like listening and personal reflection. All right, Shan.
Hello. I just wanted to contribute to the discussion on James's question, and then I saw that Leah, I'm sorry, I don't know if it's Leah or Leah, has a question as well. But with regards to the uni stuff, I would love, I know that it's difficult changing the way that things are done, but I would love for universities to do more on this, as I'm sure we all would. I know that my experience at university, I was a mature student doing my physio degree, and I kind of became aware that I was trans while doing my degree. So I was going through my social transition while at university studying physio, and it was hard, but I effectively just tried to make myself as visible as possible while I was doing that. I started telling people that I had changed what I wanted to be referred to as, if that's the right way of saying it. I started, if lecturers were talking about things in a like a trans exclusionary way, I started going speaking to them afterwards, and just like pointing out how they had spoken and how it could be more inclusive. And I do feel really lucky that I was comfortable enough with my lecturers to do that. And I know that not everyone's in that same space, but I know that as a result of that, they really took it on board basically. So a lot of them changed the wording in their lectures. A lot of the lecturers that I like had a lot to do with started putting their pronouns like in their email signatures and things. So even if we can't do these big changes from above, I think it's always worth just like trying to chip away from below.
Yeah.
No matter where you are, whatever you're doing, if you feel safe enough to do so. I know that I was very lucky to be in such a safe space when I was going through that. And then quickly, sorry, I realize we're well running over, but Leah, I'm really, really sorry. I don't know how to pronounce your name. But you said what are your thoughts on physio sharing their pronouns with patients? I've already mentioned it, but as far as I'm concerned, do it, 100% do it. I think we need to normalize it as much as possible. I kind of try and roll it off my tongue as if it's the second half of my name. Hi, I'm Shannon, my pronouns are they, he. I'm still waiting for the rest of my team to do it, but I hope that I'm rubbing off on them slowly. And yeah, most of them just kind of think, I don't know what they think, but they just kind of ignore it. But then the odd one of them who, I'm lucky enough again to be in rehab, so I see my patients very regularly for at least a few weeks usually. And eventually a lot of them start talking to me about it, like in rehab, and it's fine. And I end up educating people or they end up educating me. So it's just really good. I think, yeah, I think that's a really good thing to do. And the thing about what do you think about correcting patients that use incorrect pronouns? I don't really know how to answer this for everyone else, but personally for me, if I had the emotional capacity to do so, I would correct my colleagues when they got my pronouns wrong or if they got anyone else's pronouns wrong. However, I'm often too emotionally exhausted to correct when people get my pronouns wrong. But for me, with patients, I don't tend to correct them. Especially, I'm a neuro rehab physio, and most of my patients have some kind of cognitive issues. I don't think it's worth it for me in terms of my priorities of trying to get them to their goals for me to kind of throw that into the mix. I just really like helping my patients, and my priority isn't that, to be honest. But it might be with other people, especially if you work with like younger communities or less cognitively disabled communities. But yeah, that's just my personal take on it.
I think
No
as
worries.
well. So thank you. I think the other thing is that there's a safety in terms of being able to challenge people. So I think that there is a spectrum of like responses, and then there will be some people that are that haven't necessarily reflected on the impact of using incorrect pronouns, that will take a very gentle like encouragement to be able to kind of change their behavior, whereas other people, I think that it the barriers exist with other people, and it may be more challenging to be able to challenge like correct pronoun use. I guess that that if we start to kind of to try and address correct pronoun use with certain people, it builds confidence and it helps us to be able to kind of challenge in that space a little bit. But I don't think that should be left to the individuals that are that are from our trans community, because actually, as Shan referred to, like there's like an ongoing emotional toil, isn't there? Do you want to come back in, Shan? You've got your hand up. Or is there a legacy hand?
I was just going to add really quickly as well. It's about keeping yourself safe as well.
Yeah.
A lot of my appointments with people are in their homes. Unless I knew someone very, very well, I probably wouldn't engage in that conversation in their home just for my own safety. But if you're in clinic and someone else brings it up, and there's people around you, then yeah, 100% I would be happy to talk about that kind of thing. But yeah, I appreciate the pointer as well, Paul, about how I don't think people realize how knackering it is to be misgendered
Yeah.
all the time. And I personally really, really appreciate it if I get misgendered and someone else steps in so I don't have to. So thank you.
So I'd like to thank everybody for coming and joining us this evening. It's been really enjoyable to be able to share our presentation with you, and we're very grateful and very humbled about that you've chosen to spend your Tuesday night with us in February. So on behalf of myself and the rest of the leadership team and Alex and Scarlett from the CSP, thank you so much for joining us. I hope you were able to access some of the resources. We have a website, we have social media, which we can put into the chat. We have an Instagram account, we have an X account. Shan is our social media guru on Instagram, and Emma, I should also say. So yeah, it would be great to hear from you on like social media. Follow us, give us a follow, give us a wave, and we hope we can connect with you at some point in the future. So enjoy the rest of your evening, and thank you so much.
Thanks, everyone. Bye.
Thank you so
Bye.
much. Bye.